Here are 15 types of headaches and what you can do to improve them. We'll start first with the primary types of headaches. The first are tension headaches. These are some of the most common. These are usually felt all over the head. These can be a dull ache, and sometimes they'll go down to the neck and the shoulders as well. Cervicogenic headaches are one of the most common types of headaches. This is going to be originating from the neck, particularly the nerves in the neck, and it can supply pain around the head, the face, sometimes going into the eye as well, even creating tension and stiffness down to the neck and the shoulders. Next, we have cluster headaches. These are much more extreme. These may come, as it sounds, in clusters. Sometimes they can last for 5 minutes, 30 minutes, sometimes a couple of hours. And usually overall, these clusters, these episodes will happen once for a bunch of weeks or a few months in a year, and they may stop completely randomly and not have them for months at a time. Usually, as well as going into the head, this can also feel like there's a lot of pain going into the eyes and into the face. Migraines are a more neurological type of problem, and usually they go just into one side of the head. As well as being neurological in terms of the pain, it can also produce other neurological symptoms, such as affecting blurring vision, starting to have zigzag lines, starting to have a sensitivity to smell, sensitivity to light, sensitivity to sound, and it can also be with or without aura. Aura means that it feels like there's this almost warning system coming on, like you know a migraine is coming on. Without aura is when you don't get that warning feeling. Hemicrania continua is a persistent headache that has to last for at least 3 months, and it's only going to be on one side of the head. Ice pick headaches are very intense stabbing sensations that you may feel only for a few seconds at a time into different parts of the head, and they usually come in these very brief separated episodes. A thunderclap headache is a very extreme headache that will come on randomly with no other cause for it, and it will build up very quickly over around 1 minute. Usually by most people, it's going to be described as the worst headache they've ever experienced, even if they've experienced other headaches before. If you do experience this, it is a medical emergency. Please go to the hospital as soon as possible. It's not always, but many times it can be due to something like a cardiovascular event, such as a stroke. If this does happen, please get medical attention as soon as possible. Now we'll move on to the secondary types of headaches. Allergy or sinus headaches. As noted, this is due to allergies that someone may be experiencing, such as dust or pollen or sinus issues that they may be having, and as a secondary effect, they start to have a headache. Hormone headaches are another type of secondary headache, most commonly happening in women, especially around their periods or around pregnancy. Birth control pills can also be a trigger for these hormonal headaches. Caffeine headaches, as it sounds, are going to be due to caffeine. However, interestingly, it can be either because of too much caffeine or too little caffeine. If someone has a lot of caffeine every day and they stop cold turkey, this could also be a cause of their secondary headache. An exertion headache will come on after intense bouts of exertion, such as exercise or someone having to push themselves physically. This is due to an increased blood flow into the head, causing that headache. Similarly, when looking at blood flow, another type is going to be hypertension headaches. However, this is not going to be based just on exertion. This can also be when someone is having any kind of increase in their blood pressure, and that then starts to produce this headache. Next, we have rebound headaches or medication overuse headaches. We made another video on this that you can check out on our page, but this is where someone is taking medication and as a side effect, they're starting to have an increase in their headaches. The strange thing about this is that the person may be taking the medication for headaches, but it actually makes the headaches worse into the long term. Post-traumatic head injuries can produce headaches. This may be due to a whiplash, a concussion, or any other knock to the head, but many times this can start to become a more chronic problem if it isn't handled very quickly. We also have spinal headaches. Even though it may say spinal in the name, it's not really due to the spine as much, but usually it's going to be attributed, in most cases, to a spinal lumbar puncture. It's a particular type of medical intervention. If this test is done, the lumbar puncture, it can potentially start to lead to change in CSF flow, which can lead to headaches. For each of these types of headaches, there's different medications that may be suggested. For some, it may also mean there's a medical intervention that needs to happen, such as if you have a thunderclap headache. Again, if you get that, please go straight to the hospital. However, if you've already been to see your doctor and maybe they've already tried some different medications, maybe they've even tried other therapies, they've tried different things like massage, they've tried soft tissue work, then maybe you need a different approach. Here at Vitality Chiropractic, we have over 10 years experience helping thousands of patients. We see cases of migraines and headaches of various different types every single day, especially ones which have not been responding to medication. If you suffer from headaches, leave a comment down below or follow us for more information.